Good morning. Happy Friday, everyone. It's Amy Stoehr. I haven't been here in a while, but I'm glad to be back for 11:11, and I have guests with me. I want to introduce you to VanArsdale, our physical therapist in our outpatient center, and Elisabeth Archer, who is our physical therapy assistant in our outpatient wellness center. And I wanted to let them talk to you a little bit about themselves and what we can do for you here at our outpatient clinic. So, Lane, do you want to start?
Yeah, sure. So I'm Lane. I've been at Richfield for over 5 years, majority in the outpatient setting, a little bit in the ALFs. But I live in Salem with my husband and our daughter, who is actually 1 today.
Oh,
Today's her
happy
birthday.
birthday.
Yeah. And let's see, you tell them about yourself first, and then we'll get into.
Okay. My name is Elisabeth Archer. I have been at Richfield since the end of December. Before that, I've worked in assisted livings. I'm helping out Lane in the outpatient setting downstairs. I'm really enjoying it. I have a husband that I've been with 11 years and 3 dogs, 1 cat, 6 chickens.
Oh, wow.
Yeah.
I didn't know about the chickens.
Yes, I've got cute little dwarf chickens.
So we've been talking about over the past few months how much our outpatient caseload has grown. And so we've talked about Lisa, and Lisa's now there every day, for half a day or a few hours?
Just about half a day.
Yeah. So, and Lane's there too, and Lisa and Lane have spent a lot of time together. So Lane has taught Lisa all of her tricks and tips, and you want to tell us a little bit about outpatient and what you do?
Sure. So what's typical is you get an order from your doctor. Say you went to your doctor for your checkup, or you were having an issue, and your doctor would give a prescription for outpatient therapy. What you would do is you would call or bring the prescription by to Debbie, who handles all the insurance work and the scheduling in the wellness center, and get you set up with an evaluation, and what that would be with me. And we run you, I kind of do my assessment, my test. It's really typical for what we see is a lot of balance work, a lot of gait dysfunction. Maybe you feel less steady on your feet, you've had some falls, or your legs aren't feeling as strong, or you're having knee pain, back pain, shoulder pain, all those kind of things. We deal with all of that. You come in and have an evaluation with me, and then we get you kind of set up on a plan. It's typical is 2 to 3 times per week, seeing Lisa or I. And each session's about 30 to 45 minutes long. We do a lot of balance work, gait work, strengthening, using all the equipment in the wellness gym, and therapy typically lasts, 6 weeks, 12 weeks, depending on what your doctor wants, what you want, what we feel, and then
how fast you progress.
Exactly.
Too, right?
And then we typically get you on a program where you continue on at the wellness center under the supervision of Susan Bryant, or just on your own, or get you back to where you're doing some of the classes on campus with Susan, and that's kind of the long-term plan. So,
yeah. And what you didn't mention that I know a lot of people have told me about is your soft tissue work that people love. Lane's massages are like legendary across campus. Lisa, what are you enjoying about being in the outpatient clinic?
I really love meeting all of the wonderful folks that live both here on campus and off campus, and kind of just, I don't know, I enjoy the soft tissue work that I've been doing. I'm learning a lot from Lane. It's kind of out of my normal comfort zone, so stepping in and learning this has been eye-opening for me, and I hope to, learn more and see all your wonderful faces.
That's awesome. So Lane is teaching Lisa all those tricks of the trade with the soft tissue. So, Lisa or Lane, you're in good hands with either one.
and we see a mix of people that live here as well as people from the community. So that's another thing you can think of. You don't have to live here to have therapy here. So.
And, I've worked with a few people on campus who, when I do well power events, they talk to me and say, I'm weaker, or I'm losing my balance. If that is the issue, if you are having concerns like that, Debbie or myself or Lane, we would all be willing to call your physician. We've done that before and said, you know, this resident is experiencing some issues and we have an outpatient clinic here and we can get orders from your doctor that way. So we can kind of help you with all that, you know, the backside of getting started with PT. And Debbie is awesome at verifying insurance and letting you know if you have an out-of-pocket expense and what that will be. So we'll take care of you so that you have all the information before you start.
Yeah, and you don't have to have an actual injury or pain to come to therapy. It can be like how Amy said, just you feel less stable, you feel like your balance is off, you feel like your legs have gotten weaker since you've been cooped up for the last year. That's really common. What I'm seeing now is people just don't have the strength that they had before COVID. So those are all valid reasons and approved reasons to have outpatient therapy.
Yeah, that's a great point. You don't have had to have had a fall or an injury. If you are feeling like, you know, you have declined in some way in your strength or balance, that warrants physical therapy. Anything else you want to add about the outpatient clinic?
I feel like I would add that, you know, coming in here, doing your outpatient therapy, and we give you a kind of baseline to continue outside. So once you're done with us, you'll have like the knowledge to be able to continue progressing once you're done. So that's always, we're kind of opening the door for you to continue your exercise journey.
Yeah, and exactly what Lisa said, and we also have the pool. We do aquatic therapy.
Right, that's right.
So we've been seeing a ton of those kind of patients as well, and a lot of the residents, what they've been doing is coming to me for aquatic therapy, and then we transition you to Susan Bryant's water classes. So that's going really well.
And I'm sure that's really popular since the pool was closed for so long. Yeah. I want to mention, too, that, you know, obviously most of you know Lane and you've gotten to know Lisa, but we also do provide occupational therapy and speech therapy in our outpatient clinic. So again, you know, you've met the occupational therapist. If you're having declines in, you know, caring for yourself, your activities of daily living, or from a speech perspective, if you're having, you know, your memory is not as good as it used to be, or you're having swallowing problems, we can treat that here too. You don't have to go off campus. We're here, you know, we can offer all of that to you. So we're a phone call away. You can call the outpatient clinic and talk to Debbie, or call me, or call Vicki. You know, we will get you started with whatever you need. Ladies, thank you so much for joining.
Sure, thank you.
Yes,
That was
thank you for
awesome.
having us.
I do want to let you all know, if you see people walking around campus today in orange t-shirts, that is the United Way, and they are here putting up birdhouses all over campus. And I didn't know this, but different birds like different types of birdhouses. So they're putting up bluebird houses and, I don't know, woodpecker houses? I don't know. All kinds of different birdhouses across campus. So if you see them, say hi, and hopefully we'll get some birds that we can watch and enjoy. All right. Well, that's 11:11 for today, and thank you all for joining, and we hope you have a great weekend.
Thank you.
Bye-bye.
Yes, thank you.